Hello, Mrs. Smith. Hello, Mrs. Smith. Nice to see you. My name's Dr. Ahmed. I'm one of the doctors and I'd just like to examine you today, if that's okay.
Yes.
Okay. You just relax. Okay. Just taking a look at you. Okay. All right. And just take a look at your hands to start with. Just turn your hand over. And can I take a look at this hand as well? Okay, and turn your hands over. Thank you. Okay, that's lovely. Thank you. Just going to have a feel of your pulse. Just relax your hand down. And a feel of the other side. Thank you. Do you have any pain in your shoulder?
No, I haven't.
Thank you. I'm just going to raise your arm. You just relax. Thank you. I'll check the blood pressure at this point. Okay, just turn your head slightly that way for me and just relax. I'm just going to have a quick look at your neck. I'm just going to press on your belly if that's okay.
Pardon?
I'm just going to press on your belly, your
Yes.
abdomen. So if you can keep your head turned that way, that's lovely. Just going to have a look at your face now if that's okay. So just look at me. Thank you. Close your eyes. Thank you. And open. And just open your mouth for me. Pop your tongue up to the roof of your mouth. Lovely. Thank you. Just going to have a feel of the pulse in your neck if that's all right.
Yes.
Just relax. Thank you. Okay. All right, and I'm just going to examine your chest now. Is that all right? Is it okay if I slip this down
Yes.
slightly? That's fine. That's okay. All right. I'd just like to have a look at your chest now if that's okay.
Yes.
And if you can just sit forward for me, I'll help you. Just relax back. Thank you. Okay, just going to have a feel of your heart now if that's okay. I'm going to pop my hand underneath here. Okay, thank you. That's fine. Just going to have a listen to your heart if that's okay. Just going to have a feel of the pulse at the top here. Okay, you can pop this left arm behind your head for me and just roll over slightly onto your left. That's fine, thank you. And if you can sit forward for me, that's lovely. Just having a feel of the subclavian artery. Thank you. Breathe in, breathe out, and hold it. Breathe normally. Breathe in, breathe out, and hold it. Breathe normally. And once more. Breathe in, breathe out, and hold it. Breathe normally. Okay, I'm just going to have a listen to your neck if that's okay.
Yeah.
So take a nice breath in, breathe out, and hold. That's fine. Breathe normally again. Breathe in, breathe out, and hold. That's fine. Breathe normally. Thank you. Just whilst you're sat there, just going to have a listen to the back of your chest whilst you're there. Thank you. Breaths in and out through your mouth. In and out. And again. And out. And again. And out. And again. And out. Just going to have a feel of the bottom of your back there. That's fine. Okay. And you can relax back again. All right. I'm just going to have a feel of your ankles.
Yeah.
Just lift those up a little bit more.
That bruise is where I hurt my leg.
All right. I won't press on that side then. Just going to press gently. Okay, thank you. I'd also examine for radiofemoral delay. I've already examined for radioradial delay. Check the blood pressure, check the patient's temperature, pulse and respiration, and dipstick the urine. So in examining Mrs. Smith, what I found is that she has a regular pulse rate of around 80 beats per minute. There are no scars to be found on examination. The venous pressure is not elevated. The apex is displaced and thrusting when examined. She has a loud pansystolic murmur, heard loudest at the apex, radiating to the axilla. There's no evidence of any cardiac failure. And though there's some mild peripheral edema, it's certainly not pitting, and it's more pronounced on the left than on the right. Mrs. Smith appeared comfortable on examination. I found her to have a loud pansystolic murmur, heard best with the patient in the left lateral position, loudest at the apex, radiating to the axilla. There was no evidence of any peripheral edema. The patient was otherwise in sinus rhythm, and I didn't observe the venous pressure to be elevated. In summary, this is a lady who has mitral regurgitation with no evidence of any pulmonary hypertension at this point in time. Having determined that she's got mitral regurgitation, I'd wish to investigate her further with an ECG and an echo and establish whether or not she has any evidence of pulmonary hypertension, together with the severity of the mitral regurgitation. Also assess the LV function and assess for any other valvular pathologies. So especially in the case of patients with mitral valve disease, it's important to ascertain whether or not the patient's either in sinus rhythm or in atrial fibrillation. Having determined that, when you examine the venous pressure, note whether or not it's elevated. Is there any evidence of pulmonary hypertension, such as a right ventricular heave, a loud pulmonary second sound, or a raised JVP, and evidence of peripheral edema that might point towards pulmonary hypertension, in addition to the mitral regurgitation. In mitral regurgitation, you expect the apex to be displaced and possibly thrusting. The murmur is loudest with the patient in the left lateral position, so ensure that you do manoeuvres with the patient in the left lateral position and auscultate not only at the apex but also in the axilla, demonstrating that you know that the murmur radiates to this place.